Hello and welcome back to another video. Today we're going to be going over macrocytic anemias, and we're going to be spending the most amount of time on folate and vitamin B12 deficiencies. So specifically megaloblastic macrocytic anemias, and in just a moment we're going to explain what those things are. But to get started, quick recap: an MCV above 100. We're thinking macrocytic anemia. So if you recall from our previous anemia videos, the red blood cells undergo multiple divisions until they reach maturity. So if this was the beginning, the precursor of a red blood cell, it would split into two red blood cells, and then those two would further split, and so on and so forth, and until they reach full maturity. In the case of a macrocytic anemia, where the MCV is above 100, the red blood cells are a little larger than normal. And the reason is because with every division of the red blood cell, the cell gets smaller and smaller. And in this case, we have one less division occurring. And the reason is because we don't have enough DNA precursors to keep dividing. And so because we don't reach the final stage of division, the cells turn out to be a little larger. That's why our MCV is greater than 100. And the reason why we don't have enough DNA precursors to keep dividing is because we're lacking folate and vitamin B12. And these two things are very important in the synthesis of our DNA precursor molecules. We had mentioned that we're going over megaloblastic macrocytic anemias. What does that mean? Well, we know that macrocytic anemia is anything with an MCV greater than 100, and the fact that it is megaloblastic is letting us know that there is impaired DNA synthesis. And like I mentioned before, the most common cases are folate or vitamin B12 deficiency. And in this case, where we have megaloblastic anemia that is macrocytic, we're likely to see in a blood smear hypersegmented neutrophils. If we were looking at a simple macrocytic anemia that is not megaloblastic, we're not likely to see these hypersegmented neutrophils. This plain, I guess you can call macrocytic anemia, is mostly caused by alcoholism or liver disease. But in this video, we're going to be going over the megaloblastic type. So first, we're going to talk about folate. Folate is something that we get in our diet, and so it's very important that we have a high-quality diet, and folate is absorbed in the jejunum, which is a part of the small intestine. And it's important we have it in our diet because we don't store much of it in the body. And so maybe you have cancer, maybe if you're pregnant, maybe you're taking a medication like methotrexate. All these things can increase demand of folate in the body. And it's actually pretty common for women who are pregnant to have a folate deficiency. And their doctors will actually put them on supplementation for that. But some clinical findings we can find with folate deficiency are macrocytic red blood cells and hypersegmented neutrophils, glossitis, obviously a decreased folate level in the serum, and elevated serum homocysteine. Now, homocysteine is interesting because homocysteine requires a methyl group to be transferred to it, and in order to transfer that methyl group, we need folate. So if we're deficient in folate, we can't get the methyl group to be transferred to homocysteine, and we can't make methionine. And so what happens is homocysteine builds up for this reason, because we can't get the methyl group transferred, and we can't get methionine to be made from homocysteine. And then another finding that's very important is normal methylmalonic acid. And the reason why this one's really important is because this is how we're going to know between folate and a vitamin And this is how we're going to differentiate between a folate and vitamin B12 deficiency. And the reason is because methylmalonic acid gets converted to succinyl-CoA, but it requires vitamin B12 to do this. So if we have normal levels of methylmalonic acid, we know it must be a folate deficiency because our vitamin B12 is being used to convert it into succinyl-CoA. However, if we have elevated methylmalonic acids, that is letting us know that it's not being converted to succinyl-CoA, so our vitamin B12 must be the problem. And vitamin B12 is derived from animal proteins, so something common in vegans. And once in the body, vitamin B12 is going to bind to something called R binder. R binder is then cleaved off in the small bowel by our pancreatic enzymes. So if someone has pancreatic issues, or maybe they don't have a pancreas for whatever reason, this becomes an issue, right? You could be deficient in vitamin B12 because your vitamin B12 can't bind to your R binder. But if that's not an issue, vitamin B12 then binds to intrinsic factor, and that is then allowing it to be absorbed into ileum. And so you have large body stores of vitamin B12 deficiency, unlike folate. Symptoms take oftentimes a long time to develop. But the main risk factor here with vitamin B12 deficiency, other than vegan diets, is pernicious anemia. And pernicious anemia is an autoimmune attack on the parietal cells of the stomach. So they're no longer able to produce intrinsic factor. And so that makes it a problem to absorb vitamin B12 because vitamin B12 requires intrinsic factor to be absorbed in your small bowel, specifically in the ileum. So if we have pernicious anemia and our immune system is attacking our stomach's parietal cells, we're not able to produce intrinsic factor and we're not able to absorb vitamin B12 from our diet, and that makes us deficient. And a quick mnemonic to remember what parietal cells do are the 3 P's. The first P stands for pink in color. The second stands for pernicious anemia, which we just talked about. And the third stands for proton pumps for acidity in the stomach. And some clinical findings that we can find with vitamin B12 deficiency is going to be degeneration of the spinal cord because methylmalonic acid can't be converted to succinyl-CoA because we're lacking vitamin B12. We spoke about that here, how in folate deficiency we have a normal methylmalonic acid, but if we were deficient in vitamin B12, methylmalonic acid would be elevated, and that causes damage to the spinal cord. We'll also see glossitis, similarly to folate deficiency. And of course, we'll see hypersegmented neutrophils with a macrocytic anemia and a low vitamin B12 level. And that is all I have for you today for macrocytic anemia.